Here we have the Chatham Daily News, guys, back from September 10th, 2021. The CKHA mandates vaccines for all staff and volunteers. Oops, should have said flare there, but that's okay. We're talking on their pro end. And so all staff at the 2 Chatham Kent Health Alliance hospital sites will need to be fully flared by the end of next month, effective October 31st, 2021. October 31st, 2021, right? Yeah. All Health Alliance staff, professional staff, and volunteers, including board members, students, and contractors. You're like that guy who comes in to like fix the light bulb, will be required to have 2 doses of the Mutant 19er flare, according to released issue Friday. The first 2 doses of the 2-dose series flare must be received by September 18th, with a subsequent dose no later than October 17th in order to be deemed fully flared by October 31st. Quote, staff are not fully flared nor have provided a valid exemption by October 31st, 2021 will have their employment terminated. Notice it says a valid exemption. You know they're going to run you through the ringer and not give in at all. There's going to be no valid exemption. Or for professional staff, their privileges suspended on an immediate midterm basis, hospital stated. Officials stress that the Mutant 19er cases are increasingly rapid in the community and across the province, with significant impacts affecting those who are unflared. This week in Chatham Kent, more than 100 active cases were recorded. The vast majority of hospitalized Mutant 19er positive patients in Erie St. Clair Hospital are not fully flared. Now, let me just interject. The vast majority of hospitalized Mutant 19er positive patients. So just because you took your pregnancy test and you're positive, that doesn't mean you're actually pregnant, right? Especially in the case that I'm referring to with my analogy. Just because the pregnancy test says you're pregnant or not pregnant does not mean it is true. Okay? And it does not mean you're hospitalized for the reason of that. So, we all know the false pregnancy tests when you are pregnant or whatever is totally all over the place. The gold standard is like not even a copper standard. It's like the sand dust standard. So the flare is our best defense. I quote, flare is our best defense. Well, no, it's not. Against the highly contagious mutant, and the best effort to lessen the impact of the 4th mutant wave, which is upon us. We are grateful to all of those who have already been flared, said Lori Marshall, the hospital group president and CEO, in the release. Our enhanced staff flare policy ensures the best possible protection for our patients and their families, staff, physicians, and the broader community, while reducing the potential risk of the Mutant 19er amid the delivery of vital healthcare services. This is wild. You know what? I probably can't even... I'm talking about so many flares and mutants that I probably have to put this on the Canadian Journalist just to be safe, guys, as I'm a mid-strike from CensorTube. Under the current policy in place, all employees, credentialed staff, contractors, students, and volunteers are required to provide evidence of full flare upon the completion of regular testing. Man, anyone who is not fully flared is required to complete a mandatory education module on the flare unless a medical exemption is provided. This is wild, guys, right? Super wild. So, the flare policy. All new hires are required to be fully flared on their first day of employment, if not fully flared, and new hires offered employment to be rescinded. All students must be fully flared before their first day of learning on site at Health Alliance Hospital. All volunteers, including board members. All contracted service agencies or contract. A medical exemption may be sought as outlined by a directive in exceptional circumstances. If approved, testing will need to be arranged and discussed prior to individual attending the hospital property. Any other personnel who have office space within the building or maintain work. Yeah, guys, tyranny, full on. This is Marcel with Canadian Journalist. Cheers.